open enrollment period for healthcare.gov and all the Affordable Care Act, healthcare exchange, all that wonderful health insurance plans that we can get in the US. What is changed for 2022? Well, they've increased the maximum out-of-pocket from $8,550 per person, or $17,100 for the entire family. They raised that amount by $300 for the whole family, or $150 per individual. So if I were to buy health coverage for myself, my maximum out-of-pocket responsibility is going to be about $8,700. It's not going to be about, that's the most it can be. You can buy plans that make that lower, but for the most part, most plans, their maximum out-of-pocket is going to be $8,700 for the individual and $17,400 for your whole family, or pretty much any group of people that's 2 or more. One thing I also picked up for this 2022 is that the silver plans, the silver ranked metal plans, are useless. Unless you have the CSR, the cost sharing or cost savings reduction due to your income level, it's most times not worth it. There are certain cases where it doesn't make sense to enroll in a silver plan because it looks almost exactly the same as the gold plan. But for the most part, unless you're getting the CSR savings, then probably better off either in an expanded bronze or paying up more for that gold plan. Again, for 2022, the bronze plans are still going to be the most value for those people who are extremely ill. I know it's always counterintuitive. I never knew about this in the beginning either, but for bronze plans, you have a low premium and the same maximum out-of-pocket responsibility as everyone else who chooses more expensive plans. So if you do the premium plus your maximum out-of-pocket, that's the most financial responsibility you will have. If you choose a more expensive monthly premium, that's dollars that you could have saved that will go toward your max out-of-pocket if you're already using up a lot of the healthcare. And if you want to know how you can tell if you're using up all the healthcare, well, if you hit your maximum out-of-pocket this year and not much to change, you'll probably hit it again next year. And you can go check out the link down below to find out how you can plan for those types of things and how you can figure out, I guess, algorithmically which plan is going to save you the most money based on your doctors. Another thing you can do for 2022 when you're shopping for health insurance is see which services the deductible does not apply to. Many services like your primary care visit, preventative screening, and sometimes generic medications, you can actually get without having to pay that super large deductible. So for you really healthy folks that might see the doctor once a year or might not even be on any kind of medications, even though this plan might have a huge deductible, the services you actually use, you might be able to get, preferred cost sharing by just picking the right plan. So look to see what services do not need the deductible, or you do not have to pay for the deductible to get a reasonable copay for. And lastly, for 2022, the things that can help you save the most money is going to be really seeing how many times you use different services. Now, I know medical emergencies can come up and who wants to go to the ER, but unfortunately we can't really, plan for those things, right? If we could, that would be weird. So for medical emergencies, those things, no one knows it's going to happen. Just hope for the best, but expect the worst. What you can do for the basic stuff though, if you only see your primary care doctor once, and maybe your cardiologist or diabetes doctor once, then that's only 2 visits a year. How much are those 2 visits really going to cost you? If you can see here, CVS has a list of all their services. Doctor visits are anywhere between $100 to $150. This site here says that normal doctor visits can range from $300 to $600. So if you're only going to go once to see those doctors, $600 to $1,200 for full price. If you didn't have any insurance, that's about how much you may pay for it if you were, having to pay through the deductible. Is that $1,200 that you're going to spend out of your pocket really worth paying for a $400 or $500 per month, premium increase from getting that more expensive plan? Those are things you can think about, and that's going to require more work. But if you want a quick and easy kind of way to figure out how much money you need to spend out of pocket to break even when buying a more expensive plan versus buying that high deductible bronze plan, click down here in the link below to download my free Excel spreadsheet where I pretty much just tell you where to plug in the numbers and to tell you how much you would have to spend on a bronze plan to make the next level silver, gold, or platinum plan actually worth buying. And You can see how much medical spending you should account for the whole year by looking at the maximum financial risk. So this helps you just figure out what you can do to help lower your costs for your health insurance next year. You guys all stay healthy, and I'll see you in the next video. Background noise doesn't matter. It might add color to my very boring video about something that's very boring.